Hello everyone and welcome to today's Know Your Fertility Wellness webinar. I'm John and I'll be your host for tonight. The webinar will begin shortly, so do bear with me. I have some announcements to make. There'll be a Q&A segment during the webinar where you may ask your fertility related questions to the doctors and our expert over here. So if you have any questions, do ask away. Besides today, we have another Know Your Fertility Wellness webinar next Friday on the 13th of November at 8 p.m. We'll be featuring doctors from KK Women's and Children's Hospital and Singapore General Hospital. The topics we'll cover then will be the do's and don'ts of baby making, getting pregnant during the pandemic, the common causes of infertility for males and females, and when is the right time for fertility treatment. All very good questions, so I guess I'll see you guys next week. You'll receive a feedback form at the end of this webinar. Do help us out by giving us your valuable feedback for a chance to receive a Point of Care International goodie bag, each consisting of 8 ovulation test strips and 2 pregnancy test kits. Terms and conditions apply, so please help us out with the feedback later on. I'll give you another reminder. If you're married, trying to get pregnant or planning for a baby now in the near future, sign up to receive a fertility health check or traditional Chinese medicine fertility consultation. Send in your details and you could receive a fertility health check from Thomson Fertility Center or a traditional Chinese medicine fertility consultation from Tom. Let me do that again, okay? Send in your details, okay? And you could receive a fertility health check from Thomson Fertility Center or a traditional Chinese medicine fertility consultation from Thomson Chinese Medicine. Got it? Terms and conditions apply. Visit ilovechildren.sg to sign up today. Sign up is open till 30th November, 11:59 p.m. Okay, I'm almost done. If you're looking for peer support while trying to conceive, join I Love Children's fertility support group and ask questions anonymously or share your personal experiences with others. Doctors may be invited from time to time to share some of their advice. Interested couples may follow I Love Children's Facebook page and request to join the Fertility Support Group Singapore. So some of you here may be hearing about I Love Children for the first time. So I'm going to tell you a little bit about what they do. I Love Children is a voluntary welfare organization that's set up in 2005 with the purpose of keeping Singapore young. By advocating a higher priority to having children, educating couples on fertility wellness, and promoting a society where children are loved. So do follow us on Facebook and Instagram at I Love Children SG to keep updated on I Love Children events, contests, and giveaways. If you wish to donate to I Love Children, please visit ilovechildren.sg and find out how you can donate and be eligible for 2.5 times of tax deduction. We are done with announcements. This event is brought to you by this Know Your Fertility Wellness 2020 webinar. It's organized by I Love Children, supported by Thomson Fertility Center, Thomson Chinese Medicine, Singapore General Hospital, KK's Women and Children Hospital, and Asia PR Works, in support of Made for Families. So that's all the announcement. I'm done. Thank you very much. A round of applause for me. Thank you very much. Okay, so in a recent fertility wellness poll, we found out some stuff, okay? So I'm going to share the results with you, and then after that, we're going to do a poll as well. So we found out through that poll that 42% of participants think that they need to try for less than 6 months before getting pregnant. I also thought I was wrong. 74% of participants would consider undergoing assisted conception procedures, which is like IVF, if they have fertility challenges. So if you find yourself in the 74% or not, we have a very interesting and very technical presentation later by Dr. Balaji, so stay tuned for that. 42% of participants would try to conceive naturally for 1 year before considering assisted conception procedures. Me also. Okay, now we want to get to know you guys a little bit better. And so if you guys are tuning in right now, we would like to engage you with a quick poll, okay? So in the next 30 seconds, do share your responses on the following question. Question number 1. Of those of you tuning in, how many of you are ladies, gentlemen, or tuning in as a couple? So how many of you here are trying for a baby, expecting, married with no children, yada, yada, yada? How many of you here have gone for a fertility health check before? Question number 4, and how long do you think you need to try before you get pregnant? Once again, this one, very tough. If you have a child, how long did it take you to get pregnant? So I want to know that, and I'm going to share the results shortly. So do vote away. Okay, to the last question, let's go back to the panel. For those of you with children, which is all of you, I realize, except me, how long did it take for you guys to have your first child? Physician Ho.
I tried natural for 2 years and conceived.
2 years. Is that what you expect?
Well, we weren't really
You're not
very,
serious yet?
yeah, not very serious about it.
Okay.
Yeah.
Dr. Balaji?
2 years.
Oh, also 2 years.
2 years, yeah. The first year I was doing my PhD, so I wanted to finish it.
So you didn't really try lah?
Yeah, I didn't try for the first year, so it's the second year.
So you tried for 1 year, you got it.
Yes, yes.
Well done.
Trying is more than 6 months, less than a year for both.
Oh, that's
that means
great.
for each one is like that.
What's intense trying?
Intense trying.
Wow, that's a weird question. In terms of like, never mind, we move on, we'll come back to that later. Jane, how about you?
I was pregnant my first one through IVF. So,
right.
But
which we're gonna go into that
we will talk about it later. But yeah, but before the whole IVF, we tried for about a year plus.
Right.
With like medication and herbs and everything. So I'll talk about that later.
Okay, very good. So I myself is closing into a year and I'm going to share some of the responses here. Can everyone see that? Okay, so most of you guys are tuning in as a couple as you should. And then there are more ladies and gentlemen as I expect. How many of you here are, also a lot of you guys are trying for a baby, 66% of you are. Married with no children, that's where I fall as well. Question 3. How many of you have gone for a fertility health check before? Oh, it's 50-50. Interesting. Question 4. How long do you think you need to try before getting pregnant? Most of you guys think it's within a year. I also thought. We'll find out more later. And how long did it take you to get pregnant? Yeah, okay. If not, you won't be here lah. Okay, that makes sense. So without further ado, I'd like to introduce the guests. You guys have heard some of them tell us a little bit about their own conceiving journey. And so I'm going to introduce them to all of you. First, we have way over there, physician Ho Chin Yi. She's from Thomson Chinese Medicine. She's married and mother to a 17-month-old baby. So congratulations. Next, we have Dr. Balaji. He's the chief embryologist of Thomson Fertility Center's IVF lab. Dr. Balaji is married for over 30 years with over 2 children, both over 20 years old. So they're already starting to yield revenue. And then we have Dr. Janice Tung. She's a consultant O&G at Thomson Fertility Center. Dr. Tung is married and has a 3-year-old child and a 5-year-old child. So congratulations. And finally, we have Dr. Jane. I'm kidding. Jane is not a doctor. Jane's an influencer and friend of mine. She got married to DJ Vernon Ang in 2014. Vernon A. in 2014, and she's undergone IVF treatment to conceive her first child and is currently naturally pregnant with baby number 2. So congrats, Jane. Our first sharing will be from Jane. And today we are going to ask her to share her story about them trying to conceive and then eventually how did the decision-making process get to IVF.
Okay, cool. So we got married in 2014. So that's 6 years married.
Wow, it's quite long.
Yeah, correct. So 2014, and then we decided to have like a bit of couple time first, like for 1 year to enjoy like this, couple time. And then, so 1 year later, we decided to get pregnant. We tried to get pregnant. So we did things the old school way. Tried for like 6 months plus, nothing happened. So we decided to see a gynecologist for an opinion to see what's going on, like, why is it taking so long? And actually, the gynae also said the same thing, like 6 months is actually not a very long period of time, right? So he told us to continue trying, and it also gave us Clomid, which is like a medication to like help with ovulation. Am I right? Yeah, right. It's very fuzzy. Yeah, so we actually did that like a cycle of it, but nothing happened. And then after that, he told us it's okay, just continue trying. You never know. We are still very young, so okay. So after that, it was almost close to a year where nothing still happened.
Right.
We went to see a TCM. And then, so we started taking herbs from TCM and everything to try to like regulate the body and everything. But I didn't last, we didn't last very long because the herbs were like, I'm so sorry, but it's really terrible. It was quite.
It tasted bad lah.
It tasted bad. I mean, the one that I went to, they only prescribed the herbs, so you have to boil the soup and everything. They didn't have the that powdered forms. Like, that was easy. That would have been way easier, but they didn't have that. So I think I took that for about like a month plus. Like my husband and I both, we took.
Right.
And then nothing happened again. So I just happened to like bump into a friend who went to this gynae who also specializes in fertility. So I decided to go to him, and that was sometime in 2017 as well. We went to see him, and then we did like a series of tests. So I think at that point we were already very disappointed. Like it's been it's not very long, but it's also not a very short period of time. Yeah, and like as for a woman to keep seeing red every month, it's very frustrating for a couple who's been trying for so long.
Right.
So so we decided to see another gynae, and he gave us options to explore, and he recommended IVF, which was what we did in the end. So I think there are a lot of different factors that comes into play, whether it's IU or
But
IVF.
how do you know like it was time to get medically involved with IVF? Because you also never tried for very long. Right?
Yeah, actually, when we went to see the gynae, we didn't think we were going to do IVF. We just wanted to see what's going on. So we actually did a lot of tests, and like we did a scan, and like after doing all that and got all the test results, he just said like, okay, so this is what we have on the table, and this is what I recommend you.
Right.
So that was how we derived at that
So it's
decision.
like, I just get it done.
Yeah. Sort of, yeah.
Yeah, I mean, I felt you when you talked about how frustrating it could be.
Yeah.
For me, I'm very glad that I went for a fertility test, and I know that like my guys got problem, because every time we try, like my wife and I, they would. Then when my wife sees red at the end of the month, she will say, "Oh, I'm sorry, my menses came." Then I'm like, "No, why are you sorry? I'm the one with the problem," Which my wife also has chocolate C, so I'm really glad like at least we both know and very aware. If not, I also do understand a lot of women friends tell me that burden of not just motherhood, but whether you guys can get pregnant is often felt a lot heavier, by the women. Yeah, so. So how was IVF? Was it painful?
For me, physically, it was okay. Like,
What did they do to you?
what did he do?
Like, I mean,
it sounds like a torture.
What did it consist of?
Okay, so I'll just briefly explain. I'll let the expert.
Yeah.
talk
You cannot
about
explain
it.
like him.
Yeah, I
I
cannot
saw his
explain
slides
like
and there's no way you want to come close.
But basically, I went through a series of injections that I had to self-administer. So it was like one in the day and one in the evening, every day for like 2 weeks, and then
You jab yourself.
yeah, you have to jab yourself. So
Hard leh.
the first one was difficult, like the initial one. Then after it was okay, like it's just a pen law, and it just like
Okay. It's not like that.
There's another one that comes from a vial that I
Right.
did. Yeah, that was a painful one, but it was okay. So there were nights that I would cry because it's like really very painful, but it went away like after maybe like 5-10 minutes.
Right.
So I think that was the painful part, and the other painful part for me was what's that thing called when you take out the eggs? Yes, the egg collection. That was the painful part, because after that, I think you'll feel a bit of cramps, but
Right.
for me it was quite
So you're
bad.
fully conscious and
No, I was under.
Right.
Yeah, but it was a recovery part. It was quite painful. It just feels like cramps, but very bad cramps, and feel very bloated.
right.
So that was like the two main painful points, but it's nothing compared to like labor, so it's okay. Yeah, it's okay. Like thinking back now, like, it's okay. It's fine. Can do that again.
Right, like based on your experience, right? So before we go over to the doctors, let's talk
Right,
about
yeah.
you as a couple, right? How can you and your husband better support one another, or like advice for other couples out there? Like not just during the IVF process,
Right.
but for example, in a period whereby you're trying for kids, were there things that were hard to tell your husband?
I think right from the start, we were very open with each other. Like we had a conversation where we were very honest. Like, if you don't do this, it's okay. Just tell
Right.
me. We had that conversation, and I think that kind of set like the foundation of us doing and trying together. So we knew it's going to be a challenge to get to having a kid, and I think that was where each other's support came in to like, you know, to remind each other, I guess. So I think that was very important. And like, I feel that I was never alone. Even when I went in alone to do like my consultations, I had never felt alone.
Right.
Like if he was at work, he would text me, "Are you okay? Like what do you need?" Like,
Good on you, Vernon.
he's very supportive. I think
Right.
having a very supportive
Did
husband.
he help you with the self-administered injections?
Yeah, he did. He did.
Wow.
Yeah, he did.
I don't know if I can.
I mean, he had. I couldn't do it myself, so I told him.
Did you try doing it once yourself?
The pen one is easy. The vial one was difficult. So I said,
Yeah.
You just do it. I can't do
You
it.
just like a man.
Yeah.
Well done, lah.
He's like, okay, like, I'm gonna do it now. So yeah.
And I understand right now your second child is, so she's pregnant, right? As I
Yeah.
mentioned earlier. And it's naturally conceived, am I
Yeah,
right?
that's right.
How long did it take? Do you know when you started
I
trying?
no, honestly, I didn't know. Like
Right.
we were very happy with one.
Yeah.
And we didn't even think of having another one. Like not so
Right.
soon anyways. And then like, yeah, it just happened. So it happened like almost a year after I gave birth.
Right. So you wasted your money on IVF, like you're totally fertile.
But I guess it happens. Yeah, you know, like I wanted to ask the experts actually, like, you know, how common it is to get pregnant naturally after IVF. Is it something that's very common, or what happens? Like
Does
why?
giving birth after the first time make it easier to give birth the second, or conceiving the second time?
It does.
Oh, it does,
Yeah,
really?
that's right.
I was
And
not
also,
expecting
the idea is most likely she did IVF for unexplained difficulty in conceiving, and her unexplained difficulty in conceiving is of a shorter term duration. So naturally, for these couples, natural conception is really quite possible. So it's not an uncommon story. But for couples with a longer duration of infertility, then it's a different story.
Right. Okay, Dr. Tong. So right now we're going to Dr. Balaji. Oh, thank you very much, Jane, for sharing.
Thank you.
Do you have anything else you want to add?
No, I'll just.
Okay, so later we'll,
Yeah.
we'll be asking her more questions. Right now we're going to Dr. Balaji. He'll be telling you a little bit more about what goes on in the lab during IVF. What happens when these samples are collected, right, I guess. Dr. Balaji, are you ready?
Yep.
Okay.
Thank you, John. Yes. Thank you, Jen, for sharing your experience. Yes. So the whole IVF process is like what Jen mentioned. It has to be for the husband and wife to go together. So the wife takes lots of hormone injections. And then these hormone injections help the follicles to grow. The follicles contain eggs. So when a desirable number of follicles grow, then the egg collection is decided. So egg collection will be done under sedation. The doctor will be using a long needle to aspirate the follicles and the fluids. So this fluid will be sent to the lab. In the lab, the embryologist will be identifying eggs from these fluids, and then they incubate them. At this time, we request the husband to produce a semen sample, and the husband gives us the semen sample immediately. And this semen sample will be analyzed. So a semen sample will contain both moving and non-moving. Can I have the sperm video, please? So the sperm sample will contain both moving, non-moving, what we call as swimmers and lazy sperm, and then some of them are even dead. So we have to actually isolate the swimmers from the non-swimmers. So once these non-swimmers are isolated, and then the swimmers actually swim up to the top, where we overlay the sample with a particular nutrient solution. So the top portion of this nutrient solution is harvested, and this is concentrated for insemination in the lab. The insemination can be done in two different ways. Okay, the first slide, please.
Dr.
So
Balaji,
one
I
of
have
them,
a question at this point.
yes.
How do you extract the best sperm? I understand there's like 70 million per ejaculation.
Yeah.
How do you choose?
We actually do an initial count to assess the quality of the sample, see how many of them are swimming and actively or not. So based on that, we devise a technique where usually we actually keep the semen sample at the bottom of the tube and then add another nutrient solution on top of that. So all the good swimming will go into this top portion,
Right.
and then the top portion is harvested. Again, it is analyzed one more time to see the effectiveness of the separation. And once everything is ready, we go for insemination. Conventional insemination is the method in which we add lots of thousands of moving sperm to one egg. This is called the in vitro fertilization, or IVF. There is another way of insemination in which we pick up a single sperm and then inject it into the egg. So the video will be showing you how we pick up the sperm using a very tiny glass needle. Although we pick up the moving sperm, we don't want it to move when it enters the egg. So we actually whack the tail so that it doesn't move. Then we bring the sperm again using the same glass needle and inject it into the egg, and then aspirate the inner content of the egg to make everything is happening properly, deposit the sperm into the egg. So this method is called sperm injection, or ICSI in short. So we do these two ways of insemination. Can I have the next slide, please? So about roughly 18 to 20 hours of incubation after insemination, we look at these eggs the next day morning to see whether they are fertilized or not. So the fertilized eggs will be grown further in the lab. Every day we observe them. The next day, they will look like a for cell, and that's actually the second day of the program, the entire IVF program. Then we move on to another 24 hours later. It becomes an 8 cell on the third day. Then it becomes a ball of cells on the fourth day. Then it reaches an advanced stage called blastocyst, where part of the embryo will become the baby. The outer ring will become the placenta. Okay. So during these days, from the second day until the fifth day, we can transfer the embryo to the uterus at any point of the time, depending on the practice of that particular IVF center. So during the embryo transfer, good embryos are chosen. They are loaded by the embryologist into a plastic tubing called catheter, and this is passed on to the clinician. So the doctor will actually inject this into the uterus in the right place so that it helps the embryo to implant onto the wall of the uterus. Besides these embryos, if you have more good quality embryos, they can be kept frozen in the liquid nitrogen tanks under minus 196 degrees Celsius. Yeah. So this is how we do the entire process of IVF. After the embryo transfer, about 2 weeks later, patient go for a pregnancy test by giving blood. If she's pregnant, another 2 weeks later, there will be a scan done to confirm the viable pregnancy. Then it's like any other pregnancy. So that's how we do the process of IVF in the lab. Yeah.
Wow. So Dr. Balaji, as far as a mother is concerned, how do you extract the eggs? Like, what is that process?
Yeah, if you remember what Jane mentioned, so the patient undergoes sedation. It's a light sedation, actually, what we call as day procedure. So it's a light sedation. So a patient can wake up from the anesthesia very fast. They come usually around half an hour before the procedure, so we make all the identification checks. Then there will be a standby anesthetist who gives the anesthesia. Then the doctor starts the procedure by putting a long needle, which is connected to a suction pump. So by pressing the suction pump, the follicular fluid will be aspirated by the needle into a tube, and this entire tube is passed on to the lab. Of course, the eggs are very tiny. They are tinier than a full stop. So we have to use a microscope to scan through the entire follicular fluid and identify the egg. So for an experienced embryologist, it's easy to identify them. They look very shiny under the microscope light. So we pick up and then put them into another tube. So like this, supposing if a patient has, say, 20, 30 follicles, we have to finish everything. The procedure may go on for about roughly half an hour.
Right. And we have a question which is meant for the Q&A, but I thought it was a really good question to jump in at this point. Is there a downtime for IVF treatment between the times whereby you harvest the eggs and implanting it, I guess? Is there a period whereby you cannot go to work or you have to stay in the hospital?
I think Dr. Tung can explain that.
Yeah, generally, we just recommend taking the day off at least for the day of the egg extraction. Generally, because there's been a needle inside. There's some cramps, some bloating, but our patients generally do very well. They don't, most of them don't really need any painkillers before going home. Yeah. So, and actually they can go back to work the next day, which some of our patients do. Yeah. So it's just a very, very minor procedure. Sedation basically means that they are sleeping, but they are breathing on their own. So it's almost like going for a scope, a colonoscope or GD, but even less invasive than that, I would say. Yeah.
Right. And Dr. Balaji, are we able to select the gender of the baby?
No, in Singapore, sex selection for social reasons is not permitted.
But it's possible.
It's possible, provided there is a medical condition. Sex-linked diseases can be done.
Right.
But you need to seek approval from ministry.
And every time there's an egg extraction, how many eggs do you take in?
On an average of about 13 to 15 eggs per patient. But when I say average of 13 to 15, it may vary from like 0 to 40, 50. For some patients where the ovarian reserve is very low, they don't have much eggs. So we may get only 1 or 2 eggs from them. But in some cases, with only 1 or 2 eggs expected, none may be obtained.
You mentioned that if there are more embryos that are fertilized, some can be frozen and stored. And how long can they be stored?
Theoretically, if you maintain the bank, you can keep them for any longer. But in Singapore, for IVF cases, Ministry of Health permits only 10 years, just until last year. From this year onwards, they have removed the time limit, so it can't be stored any longer. But the couple has to come back and re-sign the consent to store them every 10 years.
And the point of storing these frozen embryos is more of if the first one doesn't, if they miscarried that child.
It's both ways.
Right.
Whether they get pregnant or not, these are like considered as bonus. So they don't need to undergo again all the types of hormone injections and egg collections. So frozen embryos are considered a bonus.
Right. Jane, do you have? You have.
So I have 11 frozen
embryos.
Yeah, so Liam is one of them.
Right.
My first one is one of them. So I still have some more left.
You got 10 more lah. You're
Yeah.
good lah.
I'm
You can give to some of us lah, actually. Okay, so we're going back to the polls right now. Thank you very much, Dr. Balaji, for the in-depth sharing. I'm sure we have a lot of questions for you. I took a peek at the Q&A.
You're welcome.
And there's some questions for you later. Right now, we're going back to the polls, and as I've understood it, now that you guys have better understood it, we want to know, now that you all have better understood IVF, sorry, I keep missing that word. We want to know what you guys think on this matter. Okay, so can we have the poll? The first question is, would you consider undergoing assisted conception procedures, which is what Jane has shared, what Dr. Balaji has shared, and what Dr. Tung has touched on as well. The second question is, how long will you try to conceive naturally before considering assisted conception procedures? While waiting for the answers to come in, Dr. Balaji, how long do you think, how would you answer that question from a doctor's point of view? Especially for question number 2, how long should people wait?
Okay, it's just like what Jane was explaining in the beginning. The infertility is defined as unable to achieve a natural conception after 12 months of unprotected sexual intercourse. But nowadays, we'd like to modify this definition slightly. This is applicable only for those who are below 35. So about 35, I think they should try for only 6 months, then they should come into seek for assisted reproduction or any kind of medical assistance.
Right. Do we have the results of the poll? If not, I do have another thing that I want to share. Can we actually jump back on that? Or let's go to the polls first. So, okay, in the meantime, we actually have a slide as well. Angie, are we ready for that? Oh, we are ready for this now. Okay, we'll do this first. So the poll says, would you consider undergoing assisted conception procedures if you have challenges trying to conceive? 85% of you said yes. And how long will you wait before trying, before considering? more than a year. Some of you say it's more than 3 years. Well, I think a lot of us are, a lot of this is really where you are at, and it's very, very individual. For my fertility check, I remember the doctor telling me that the morphology, of my sperm was not great. In fact, there was an indicator beside, it was a long list, right? And everything was good, 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 good. And then there was one at the bottom that for healthy, it was supposed to be more than 4%, right? And mine was less than 1. So that messed with me because less than 1 could be 2 sperm. But then the doctor told me actually a lot of guys are like that. He said he himself as well, and he has 3 kids lah. So you can find solace in that. So before we go on to Dr. Janice Tung, can we bring up the slide on the success rate for fertilization in the lab? Dr. Balaji, while they pull up the slides, let's talk about this. To me, before I saw the slides, before I came in today, I thought IVF was like a 90% thing. What are the expectations of some of the couples that go to you?
Right. Now, whether it's natural conception or it is IVF conception, age of the woman plays a major role. Nowadays, we also come to know that even the paternal age is also important. Okay. Maternal age is more important because with increasing age, the chances of conception comes down because the quality of eggs and the quantity of eggs also come down. So these 2 factors are affecting the fertility of a woman every 5 years. I think it drops by 5%. So in a natural conception, if a woman has a chance of 25% when she is about 25 years old, then it drops tremendously when she reaches 35. It is only about 10 or 15%. So in IVF, the figures are better. The pregnancy chances are better because there we are not relying on just 1 egg. We are relying on many eggs. Right? So to achieve a live birth, I think a woman needs at least 15 eggs to be collected in the IVF cycle. Right? So because of this, egg quality and quantity actually depleting every year, the chances of conception also is affected by the age. And of course, another factor is how severe the infertility is, right? So in this slide may show you that below 30 is very easy to conceive. So we see that per egg collection, there's a chance of 70%, right? But when you go higher and higher, like 35 to 39, from 72%, it drops to 53%. And when you look at those who are 45 and above, it dropped to even 12%. Actually, the live birth even may be affected more for those who are above 45. They may have a live birth chance of maybe 3%. So age plays a major role here. Showing this slide actually may project that IVF looks better than the natural conception. But the message is not that. My message is that don't wait until you are looking for a child. Rather, you get married early and then have a child early, at least the first child. So that will be very good.
Right. Okay, thank you very much. I hope you guys got a good photo of that slide earlier. And now we are going to move on to Dr. Janice Tung, in which she's going to share with us the differences in different types of fertility treatments. So Dr. Tung, thank you very much for being here. Are there any other treatment options for couples?
Okay. Yes, most certainly. So a lot of people are familiar with the concept of either IUI or IVF, but they don't realize that actually we can do a lot more as well to help with improving your natural chances of conception as well. So my advice for couples would really be after a certain time frame where you have been trying on your own, it might be better to seek some medical opinion or some fertility health assessment first, because you might find certain conditions that might be amenable to surgical treatment, for instance, that might help improve your chances of trying. So surgery may be able to treat certain conditions like endometriosis, fibroids, polyps, ovarian cysts, Okay, essentially certain lesions inside the womb, for instance, scar tissue or a septum that may block obviously implantation. And sometimes tubal blockage can also be relieved with surgery. So all these things can be treated with surgery, and that helps to either restore your natural fertility to that which it should be at the age, or improve your natural chances of conception. Sometimes these surgeries can actually be performed before IVF to improve the chances of IVF itself. So for instance, there are some ladies with blocked tubes with a collection of fluid in the tubes. So essentially when you have blocked tubes, you have no choice but to usually undergo IVF in order to circumvent the tubes. You have to get the eggs extracted and fertilized in the lab instead. So for these patients, the fluid in the tube is actually toxic to the it forms a toxic environment for pregnancy. So generally the chances of success of IVF would be lower. So surgery is done to relieve this blockage, remove the fluid, either that or also sometimes to clip and remove the connection between the tube to the womb so that the toxins don't get into the womb, and therefore help with improving the chances of success of IVF. So this helps a lot with, so surgery itself is a very good mode of fertility treatment. Then moving on, there's also ovulation induction. Ovulation induction is very suitable for women with irregular periods, or even some women with regular periods who actually may not be ovulating. And ovulation induction is given, as Jane mentioned, sometimes with oral medications like Clomid, and sometimes injections are also used. And this is used along with time intercourse. And I think the time intercourse, time love making is the usually the most tedious part of the whole process. Where it's very stressful. Yeah, and that's what I meant also by intense trying. Okay, essentially you put a calendar on the wall and you mark. And you make sure your husband knows also that he should make himself available on that day.
My doctor told me I shouldn't. He told me I should just do every other day for the whole month.
Yeah, huh? Sorry,
Do you actually do that? Is that possible?
I mean, I think that would be ideal, but essentially because it's usually not possible to sustain that for very long. So usually but it is essentially 2 weeks out of 1 month, generally 10 days to 14 days where it's still every other day.
But okay.
Yeah.
Okay.
Yeah. So this is actually a very effective method for the ladies who are not ovulating. So once you get the eggs to come out on their own, they have a very good chance of pregnancy. Then ovulation induction can be used in various combinations with IUI. So what you're all familiar with would be SOIUI. Basically, in SOIUI, there are two key aspects. One is timed ovulation. That means we give you an injection to trigger ovulation, so we know the exact timing of ovulation. Whereas in trying to rely on your natural ovulation, there's a bit of a guesswork. Yeah, and after ovulation, the reason why this timing is so important is because after ovulation, there's about 36-hour window for fertilization, which is very short. It's only 1.5 days. So getting this timing right is important. And the second aspect of IUI is getting more sperm nearer the egg. So what happens is that the sperm is collected from the husband, and then the lab nicely concentrates it to the fastest moving sperm, and so instead of a few million in the vagina, a few million sperm in the vagina in natural intercourse, you're putting a few million of good moving sperm in the womb, where it's much nearer the egg.
Right.
Yeah.
Cheat a bit.
Yeah, it's a cheat. Okay, so essentially that helps. And so when it's used in combination with ovulation induction, I think, sorry, can you pull up the success rate slide? Yeah, it's a bit of, yeah. So you will find that the success rates increases with stimulating the ovaries as well, because in natural ovulation, only one egg is produced. Right. Depending on your age, that egg quality may not be so good. Yeah. So when we use stimulation medicines, the hormonal injections, we can get more eggs, which means more chances. So essentially, the whole process of SOIUI is just to try and increase your chances of conception within the body. as best as we can. So it's very suitable for ladies who have problems with ovulation, and also couples who have unexplained difficulty in conceiving, but for a shorter term duration.
Right. It's cheaper than I expected.
Some people may not consider it cheap.
That's
Yes.
true.
Yeah. Then, of course, finally, we have IVF, which Dr. Balaji has so nicely summarized. Essentially, for this treatment, it bypasses fertilization within the body. That's the main advantage it has over all other forms of treatment. So what we are dealing with is embryos that we transfer back into a body, and each of these embryo actually has the potential for pregnancy. So IVF is not a magic bullet to conceiving, but what it does is it fast forwards the whole process.
Right.
Yeah. So it's like taking a bullet train instead lah. Yeah. And so the success rates overall, as Dr. Balaji has mentioned, they decrease with age. So my advice really would be, as Dr. Balaji mentioned, really for couples who are younger, yes, you may take a longer time to consider before going for assisted conception. But for couples who are older, like 39, 40, really a shorter duration would be better.
Right. And should a couple have suffered a miscarriage, how long should they have to wait? How long is the typical recovery process before they can attempt IVF or IUI?
Okay, so to be honest, the WHO guideline is that waiting 6 months would be preferable for before the next conception. But generally, we don't find any difference in our in the pregnancy outcomes. That means whether the pregnancy is successful, meaning it results in a live birth, even if you conceive in the next cycle after a miscarriage. So my advice would really be whenever the couple is ready, when they feel like they have gotten over the loss, because it's really definitely still a big loss. So when they've grieved and they have moved on and they're ready, then certainly as soon as possible, whenever that is.
Okay, thank you very much, Dr. Tung. So we're going to come back later to Dr. Tung with the Q&A. I also went to peep at the questions. Your questions also piled up. So we're going to give more tailored answers a little bit, okay? Because now we're going very general, right? So now we're going to move on to Physician Ho. Are you ready, Physician Ho? She's a little bit nervous just now.
Yeah.
Pat and I, my wife and I actually went to see Physician Ho, and she blew our minds when she bar our mind and she told me that my kidney is not doing great. And my wife's spleen is not doing great. I'm like, wow, you touched the same spot in our hand and figure out 2 different body parts. So I'm very excited for Physician Ho to share a little bit more about TCM fertility treatments and what actually happens there. How does it really differ with the Western science?
So in TCM treatments, we actually make use of the acupuncture, moxibustion, herbal medicine, and also sometimes cupping for fertility treatment. So what happens when you go to a TCM physician is that we'll look at some of your fertility screening results, and then we'll use what we call the 4 diagnostic methods of TCM. So John actually stuck his tongue out at us, at me, and also
She asked me, I just
I was like, can you show me your tongue? And then he stick out. And then we also feel the pulse, and we ask a whole list of questions. So I think one of the things that made an impression on you was like, how's your poop like? How's the consistency?
That's true.
Yeah. So for your case, right? The pulse, it's so from what I felt from your pulse that led to, yeah. So these are some of the signs and symptoms that help us understand your fertility health better from a TCM perspective.
Right.
Yeah. So with that in mind, then we'll plan some treatment plans that includes, like what I've said earlier, acupuncture, herbal medicine, or moxibustion, and so on for the patient.
I'm not yet.
Not yet.
Oh, yeah, not yet.
Yeah.
Because we spoke about acupuncture, right?
Yeah.
And there are levels. You don't have to do acupuncture, am I right? Like Jane, for example, she used her lifestyle as an excuse to not do acupuncture, but then every week she go back and take medicine. So, time is not the problem. But for us, we were not sure whether that was something we wanted to do just yet. We understood that acupuncture involves the neck as well, right?
No, it actually, so acupuncture, we insert needles into specific points in your body. So in TCM, we have what we call meridians and channels.
Right.
And these are like the MRT system of our body. So for example, if the MRT breaks down, yeah, like recent power outage. So there's a lot of chaos happening in the stations, right? So when we, similarly to our body, when the energy and circulation is not so good, we have a lot of issues happening. So when we stimulate these specific points in the body, it clears up the mess.
Right.
Yeah, so it activates the self-healing properties of our body. Yeah.
Right. And this process, is it usually like a treatment of sorts? You go and then you're done, or you have to go back every week for a long time?
Yeah, you have to come regularly. So for TCM, unlike IVF, it's like a 6-week thing, but TCM is an ongoing thing, and it is actually the accumulative effect of the treatment that really matters. So it's not like you come in and then like I feel your pulse and tell you like this and that. TCM is also a lifestyle. So on top of the treatment that we give you, we also provide some of the lifestyle and dietary tips that you should be taking note of.
Right.
Yeah. So I shared with you, right?
Yeah.
Yeah.
Tough, very hard one. No, I'm kidding. So for the couples out there watching, how would you advise them on when do we go to a TCM fertility center or clinic, or when do we go to a Western one?
Okay, so for couples who come to us, there's basically different types. So there are those who are just married and then they just want to get their fertility health enhanced. So they haven't been to a doctor for any fertility screening, and they just come and regulate the body. So for these patients, as long as they're young enough, we will proceed with maybe 6 cycles, and if nothing happens, and then we'll refer them to like Dr. Tong, yeah,
Right.
for further health checks, so that we don't hold up any possible underlying issues.
Right.
Yeah. Then there's another group who are in between IUI, IVF treatment. So for example, like they just did their first cycle and it failed. So some of them actually found out from internet or something that, hey, I can go for TCM. So they come over and then they try to give themselves some time to regulate the body, enhance it, and then go for the next round. Then there's the other group who are actually doing the IVF and IUI treatments. And these are the ones that we typically do acupuncture only, because we do understand that there's the concern about herb-drug interaction in the patient's body. So when they're doing the stimulation and so on, the acupuncture is done to decrease the side effects. So basically, reduce the bloating, the anxiety, and also the stress that the patients are facing. So clinically, when we see these patients, quite a number of them actually reflect the stress that they go through when they do the injections and so on. Yeah. So these are some of the issues that we deal with, and of course the underlying TCM syndrome or the body constitution that we can help to improve.
Right. So
yeah.
It's a little bit more like a whole body wellness as well, just to get your body in tip-top shape. And that's how it kind of complements Western fertility treatments, you think?
Yeah, so TCM is actually not just a treatment, it's a lifestyle, it's a holistic thing. So when we talk about fertility, for example, we don't just talk about like your kidney.
Yeah.
So for like
You also talk
Patrina,
about my bowels.
yeah. No, so like for Patrina, it's like the spleen, which is the digestive system. It comes into the picture also. So when we treat a patient, we treat them as a whole, not just a specific part of it. Yeah.
Right. Okay, and before we move on to the Q&A, I think this is the question on people's mind. What's the estimated cost for TCM treatment?
Over at our side, our herbal medicine is $12 a day, and then the acupuncture treatment is 85 per treatment.
Right, it's a
Yeah.
lot more, a little bit more affordable than.
Yeah, in the grand scheme of things, yeah.
Right. So it's actually not even TCM fertility treatment is getting more and more mainstream right now. I have a lot of friends that's recommending me all different doctors, and they usually is this sincere from Red Hill and whatnot, and they promise this pill. How accurate and is there such a magic pill, and what does this pill actually do?
Okay, so TCM, right, it's a personalized thing.
Yeah.
So there isn't such a magic pill per
Yeah,
se.
Of
So
course not, right?
yeah, so the reason why you have to do a regular follow-up is that your symptoms and your signs might change from time to time, and then we have to alter our treatment accordingly. So the powder or the herbal medicine that you get each time might be slightly different from the previous time. So it might taste,
Right.
it might still taste not so good, but yeah, you might be able to taste a bit of difference there lah. Yeah.
Right. So it's always different.
Yeah, so it's a personalized treatment.
So those pills don't exist lah, right? You heard about it before? Are you? Have you all? They always tell me it's this big black pill.
No, the pills can
I've
be
heard about
made
it
out
from
of
few
different
people already,
ingredients also.
Sorry?
The pills can be made out of different ingredients as well.
It's just like a multivitamin lah.
No lah, like so they all look the same lah.
That's true,
So
that's
there's all
true.
the TCM pills that looks the same, and then it actually contains different herbal medicine inside.
Okay.
Yeah.
So at this point, thank you very much, Physician Ho. I would like to open up the floor for Q&A. I hope you are ready. I took a pic again just now. The floor is now open for Q&A. If you have a fertility-related question to ask our guest and expert, feel free to type them out and send them over.
We are the experts. I'm just a.
Experience, you're an expert.
So at this point, right, I would also like to show the slide on government co-funding for assisted reproductive technology. 1 second on that. So this is very, very important. If you've absorbed anything from today, stuff that you think you want to know more about, something you might want to explore with your partner, and what's also a very real consideration is the cost involved as well. So I hope you take a picture of this, and if you forget, then do write into ilovechildren.sg if you have any questions as well on what are the grants and support that the government gives as well to subsidize these treatments. Couples can withdraw up to $6,000 at both private and public hospitals for each treatment cycle, and up to $15,000 for their entire lifetime. Okay, so right now I'm gonna move on to the Q&A. Are you all ready for your Q&A?
Sure.
Oh, wow. Wow. Okay, some stuff we've already answered through, so give me some time, let me sieve a little bit. Would past COVID-19 history infection affect conception rate?
Not that we know of yet.
Oh, fast game. So answer is we don't know yet, but probably not. Am I right?
At the moment.
Okay, I have not had my period for 3 months. How do I regulate my period?
That's very
This is so weird coming from me,
specific.
right? So we have a question that says, this person has not had a period in 3 months. How do you go about regulating that?
I would suggest seeing a doctor first. Yes, preferably a gynae. Find out what is the issue first, because there are many reasons for not having your menses for 3 months, one of which is actually pregnancy as well. So yes, you must check for pregnancy. Okay, and then
You might be pregnant, congrats.
no. Then beyond that, there are obviously other reasons. So you need the treatment has to be tailored to that. It's not just a matter of regulating menses. Yeah. So it's a very specific question.
Okay. We've spoken about how medicine can help and a lot of treatments can help us in fertility. However, we have a question here that asks, is it safe to have natural delivery for ladies above 40 years old?
Yes, but there's always we know for a fact that above 40 years old, there's a higher rate of emergency cesarean sections. For whatever reasons, we're not quite certain, but there's a higher rate of emergency cesarean sections. So, but it is still possible if everything else is suitable. Your doctor will advise you for vaginal birth. Yeah.
Right. And Dr. Balaji, I think this one's for you. And this person asked, how can I improve my egg quality? Is that possible?
I think you should ask Dr. Janice. So she's the one who's giving the medications.
I see.
Yes. First of all, get pregnant earlier, sooner, at a younger age. Then nothing beats that. Yeah, in terms of egg quality. Beyond that, there are certain supplements that we can give to try and improve egg quality. And on top of that, try to maintain a healthy lifestyle, avoid smoking, drinking, excessive drinking of alcohol, excessive caffeine intake. Yeah, and all these things will help as well. Beyond that, there really isn't anything else.
Right.
Yeah, we can't get past the age quite. Yeah.
How about for guys though? If we throw that for guys, how do we then improve sperm quality?
So the general advice would be to keep the testes cool. So I'm sure your doctor will have advised you avoid tight-fitting underwear, hot spas, showers. See if your line of work you have any long contact. You know, for chefs, they are always in prolonged contact with stove and heat.
Right.
Yeah, and then drivers, they spend very long time on motorcycles and vehicles. These are usually associated with a slightly poorer sperm quality. Yeah, because of the vibration injury as well. Yeah, then avoid, again, the same thing, healthy lifestyle, avoid smoking, excessive drinking, caffeine intake must limit. Then finally, men may consider some form of antioxidant vitamins. Yeah, and there are many brands available outside. Yeah. So these antioxidant vitamins I'm talking about are those with vitamin A, C, E, zinc, selenium.
Right. Thank you very much for that. We have a question for Physician Ho. I don't know whether I'm going to butcher the name, okay, because I think it's Han Yuping.
Okay.
Is Bai Feng Wang
You're right.
recommended to help with regular ovulation? Are there any cases where it isn't recommended?
So TCM, as with Western medicine, right? It's best for you to take whatever TCM medicine with the advice of a professional physician. So Bai Feng Wan itself is a commonly used TCM herb. It's actually a pill lah. Yeah, your big black pill, magical pill.
Oh, is it?
Yeah. So it also
What?
it also exists as
Yeah, it's not.
yeah. No, it can be the big black pill or it can be the many tiny little pills. Yeah. So what it does is that the ingredients does help with regulating the menses, but then it is not suitable for everyone. So if you are taking it and it's not suitable for you, it's going to cause more trouble.
How do you know it's not suitable for you?
Then you have to see a TCM physician to find out. Yeah.
Right.
So in our practice, right, the worst thing that we experience is seeing patients who actually self-medicate for a while, and then they got their health into a worse state without knowing, and then they come to us. Then we have a much more worse mess to deal with. Yeah. So really go find a licensed TCM physician to really find out more about your fertility health in a TCM perspective before you medicate yourself. Yeah.
Okay.
Yeah, license.
So I have a question that's hopefully for Dr. Balaji now. I'm trying to find your question. You help me.
Sure.
Will IVF reduce the probability of Down syndrome?
Okay, I think Down syndrome is a common problem. It's a pregnancy-associated problem, and also age of the woman. So when the age increases, the risk increases, particularly after 35. Right. So I don't think IVF increases it.
It doesn't increase.
Yeah, it doesn't. It is as common as the natural conception.
Right. Okay. So we have a lot more questions. Is it possible to have twins with IVF? Can we choose?
It is more possible to have twins with IVF, but you can't choose.
Right. So you cannot tell the doctor you want to have.
No, we can put 2 embryos in, but
So
whether the 2 embryos become 2 pregnancies is up to chance.
Right.
Yes, so we have no control over that.
Why are you so tickled by this question? I think it's a very solid
Because,
question. I would love to
no,
have twins.
Yeah, but we can't play God.
Yeah.
No, sometimes you transfer one embryo. This
Yeah,
embryo
and
can
it's
split into twins.
2.
Two identical
Yes.
twins.
Both
Yeah,
split,
so
become
we-
4.
Yeah.
Yeah, we have no
What?
control. We have
It's
no
possible.
control.
So, yeah.
Okay. So Ken is Ken lah. Your answer is yes. Does miscarriage affect future pregnancies?
Depends on the number of miscarriages. Usually in a lifetime, if you have 1 or 2 miscarriages, it's not known to affect your chances of your next pregnancy, really. There are some underlying causes for repeated miscarriages. So there are there's investigations and workup that can be done to find out what is the underlying reason and treatment tailored to that. Yeah, in order to reduce the risk of miscarriage in the next pregnancy. So it really depends on what is the issue. Yeah.
Right. Are there any long-term side effects of IVF on the mothers and the babies?
In terms of cancer risk, it's not been shown to have any increase in cancer risk, essentially breast cancer or womb cancer or ovarian cancer. So that I think is the most what they're most concerned with in terms of long-term side effects. Other than that, generally no, it does not decrease the number of eggs you have. It does not bring about an earlier menopause. The idea of IVF is that during the cycle, when we try to get more eggs out, we are actually trying to rescue the eggs which would have been discarded by your body anyway in the natural cycle.
Right.
So we are just salvaging those eggs. So we're not, we can't actually, we're not utilizing more of your eggs than usual. And therefore it won't bring about earlier menopause.
Right.
So does that mean as for me, there's lesser eggs in my reserves? Or because you mentioned you are harvesting more during
the eggs that we harvest are eggs that would have been discarded in that cycle by your body.
Oh, so it's not per cycle your body release one, man.
Yeah, it releases one, but for that one to be released, there will be other eggs that are growing alongside it, and only one will naturally grow to be suitable for ovulation. Then the rest of the eggs that were recruited in that cycle would have been discarded naturally. Yeah, so what IVF does is just try to salvage those follicles, those eggs.
Okay, we have a question regarding sperm morphology. That's not my question. Is it affected by food intake?
I think Dr. Balaji can feel that.
Yeah. No, we used to joke around sometimes that why that we see so low normal morphology for men, particularly in Singapore. Is this chicken rice? But overall, what Dr. Janice has mentioned before, the lifestyle, natural lifestyle. So as long as you have a healthy lifestyle, don't do anything, like I would say, don't overdo. You can have chicken rice, but don't eat chicken rice every day. You can go to sauna, but don't go to sauna every day. No, it's like that. So don't overdo everything. So maintain a balance.
So wait, what's wrong with chicken rice?
Hormone injection to the chickens.
Oh.
So.
You knew, man?
Now I know. It's the way he says it, it's quite cute.
Okay, this question I don't understand, but I'm going to try and read it anyway, okay? Can ectopic pregnancy happen with IVF?
Yes, and it's more common with IVF pregnancy.
What is it?
It's a pregnancy outside the womb. So essentially, it can be located as long as any place outside the womb where it's not supposed to be. So most commonly it's inside the tube. Sometimes it can be, if you have a previous cesarean scar, it can be located in the cesarean scar. So that's what we know as scar ectopic. It can be located in the corner of the womb where it's not suitable for it to grow because the corner of the womb, the muscle layer is too thin. So it will eventually rupture. Yeah, so that's called corner ectopic. So these ectopic pregnancies cannot be allowed to grow because certainly it's not suitable. They cannot be housed, the pregnancy. So eventually it will cause internal rupture and hemorrhage, which means severe internal bleeding. Yeah, and then patient might have pain and come in with a need for emergency surgery to remove the ectopic. Yeah. So in IVF pregnancies, we're actually very careful to detect pregnancy early and then to scan to make sure that the pregnancy is inside the womb. Similarly for IUI, actually, because when we stimulate the ovaries to get 3 or 4 eggs out, sometimes what happens is there's a pregnancy inside the womb, but there may be a pregnancy outside as well because of there being more eggs. It's just a increased chance.
Sorry. Okay, physician Ho, we have another question for you here. Which is, sorry, let me find it. Oh, is TCM medication suitable for vegetarians? I'm gonna guess yes.
Okay, so in
Ooh, sounds
TCM
like a
herbal
no.
medicine, right, we do have plant-based ones, and we sometimes use animal parts or shells and minerals. So if you have any dietary requirements or preferences, you will have to tell your physician in advance so that we can make some changes to the herbal medicine, like the prescription that is being prescribed for you.
So it can be vegetarian friendly lah, if you just request for it.
Yeah, you just have to highlight to us.
Okay.
Yeah. Depends on the condition. It depends on the condition. So certain conditions do really require the animal parts or minerals.
So dodgy, you say animal part like that.
Yeah. So, but there are also herbal-based herbal medicine that we can use to substitute these animal parts or minerals that we usually use.
Right. Okay, I have a question that our resident expert might be able to weigh in on. Let me attempt to supplement that question. And let me attempt to say it in the most appropriate manner. Does position matter in lovemaking for a higher chance of fertilization? So nobody wants to answer that. Dr. Balaji. Would you like to weigh in on that?
Actually, there is no proof. There is no scientific study or scientific proof so far. It depends on the belief.
Give tips to my patients, and if any of them are tuning in, they will say that I always talk about sex positions.
Right.
Yes, for certain women, okay, mainly for women with retroverted uterus, retroverted womb means the womb is tilted backwards. It's not scientific proof or anything. It's just a tip. Yeah.
So what's the tip?
No, it's not. It's just doggy style is better.
Okay.
Yeah.
I always thought it was missionary. I read it somewhere.
No, but that's because a majority of women's wombs are not tilted backwards. They're tilted forwards.
Right, and I have a myth that I want to see whether it's busted. I have a lot of advice from people telling me that you have to raise up your legs. Do you do that as well?
When you're desperate, you're willing to try anything.
I feel like that makes sense lah, cause like gravity, right? Simple science.
Just lie there and like lift your legs back. Does that work actually?
Okay, the thing is the number of sperm in the ejaculate is millions, so it should not matter. Yeah, but you're right. But intuitively, it makes sense not to get up straight away after intercourse. You need time for the sperm to pool in the vagina so the cervix can pick up the sperm to go up. Yeah, so you should lie down at least half an hour after intercourse. At
No
least.
wonder
No, but I mean, just don't get up immediately. Really, yes.
Right. Is it true that the first child is hardest to conceive? I think we talked about that just now, right? There's some truth to that, right?
Mentally, maybe lah. Mentally, it feels the hardest.
Right, but physically, because even Jane, for example, got naturally pregnant after her first delivery. Would it not, like, for example, the metaphor of warming up your engine,
Yeah,
which I think you gave me?
easier.
Do you? Sorry? Do you tell me that metaphor of how the first child might be a little bit harder, but after the body's engine is warmed up, the
Yeah.
subsequent child seems to come easier?
That's what we actually observe clinically. So, but then I don't think there's any scientific evidence on it, right? Yeah.
Couples with secondary infertility, by that we mean that after the first one came really easily, they're actually having difficulty having the second one.
Right.
Yeah, so I don't think they will agree with us if you ever said that it's easier to get the second one.
Right.
Question actually,
Good.
like about fertility. So a lot of my friends, they say that after you have your first one, then your body will like tune and reset. Is that true? Like, is that true for future pregnancies?
The elders will tell you that depends on how you did your confinement. Tuning and reset. Yeah, but no scientific basis. Really, we don't study this per se. But for certain things like conditions like endometriosis, pregnancy does help to treat endometriosis very well. So sometimes people with endometriotic cysts, the lesions may actually reduce or disappear while they're pregnant. So in that sense, that may be a form of what? Because in pregnancy, the levels of hormones are very high, and then they suppress endometriosis.
Okay.
Does that answer your question?
Yeah. Kind of.
Do doctors do confinement? Is it real?
Can I ask this question?
Okay. How big should the cyst be? Should a cyst be before like it starts obstructing fertilization and we should remove it via surgery?
If we are talking about ovarian cyst, it very much depends on what kind of cyst it is. A very large endometriotic cyst is bad news. But if it's a dermoid cyst, sometimes a 2 to 3 centimeter dermoid cyst can be left alone. Yeah, before you don't have to do anything about it. Dermoid cyst is actually a non-cancerous tumor of the ovary. Yeah, so that really depends. You should discuss this with your doctor.
What are some of the most common questions that couples have for you that you think you might want to address?
Questions? Oh, we see such a variety of couples.
Right.
Do you have any that the couples always ask?
Mine would be related to the laboratory.
Yeah.
How
Are they interested in the laboratory?
Quality, how's my sperm quality? No, but when it comes to sperm quality, I would like to say something.
Yeah.
You mentioned about lower normal morphology. Normal morphology is just one of the parameters. So semen analysis has so many other parameters. So we have to look at the volume of the semen sample and how many are moving and what's the total count of the sperm. So even if the morphology is lower, if the count is higher, that's going to compensate for this. So the sample has to be looked at holistically, not just one parameter.
That's true.
Yep.
That makes me feel better. We have a question here on the treatment of PCOS. How do we treat it?
So PCOS essentially is a condition. I won't belabor the technical points, but essentially what happens is the lady tends to have many eggs, but none of the eggs are coming out. So there's no ovulation or very irregular ovulation, such that a lady with PCOS, for instance, may ovulate maybe 2 or 3 times a year, whereas in a lady with natural cycles, they may be ovulating 12 times a year. So for that reason alone, they would definitely be less likely to get pregnant anytime soon. So for this condition, what we'll do is, fertility related, if they want to get pregnant, we try to get them to ovulate with the treatment modalities I've mentioned, which is ovulation induction or ovulation induction in combination with IUI. Yeah, before moving on to IVF. Yeah.
Okay, we have a couple that ask, for couples below 35, can we go for fertility health check after 6 months of trying? Can. Let me help you there. Haven't tried also can. In fact, I think what this whole session is about is trying to get you to understand, trying to get you to make an effort to understand your own fertility health better. In fact, you can even do that before you get married, before you settle down. But of course, if you are looking to do it as a couple, then of course, when you get married, then as soon as possible or as soon as your relationship gets serious. I think for my relationship, it really helped us beyond understanding the health conditions. It helped us understand beyond our bodies. You know, many of the things that we discuss here today, if it's new to you, it would not be new to you had you gone for a fertility checkup. I think a lot of these questions were answered by the doctor at the fertility center as well. We have a question that asks, is there any food recommendations that can improve fertility? It's a no, lah, right? We can't answer that, right?
No, I always tell my patients that essentially there's hardly a fertility diet because the fertility diet is essentially a health diet. So less red meat, more fruits and more vegetables, etc. So there isn't really a particular food substance to eat that would improve your fertility.
Okay. Okay, we have this question that what are the causes of what are the usual causes of IVF failures?
The most common reason would be the fact that the embryo is genetically not normal. So even though they look okay under the microscope, they may not be genetically normal. And one of the reasons for this is because we are not allowed to screen the embryos genetically in Singapore. So the embryologists will pick what they think is the good embryos based on how the appearance of it. But really, based on previous biopsies of other embryos, we know that normal-looking embryos may also be genetically abnormal. So for that reason, IVF can fail. The second reason, more common reason also is if the body rejects the embryo. So essentially, the embryo is like a foreign body to the woman. So the woman's immune system can reject it. Yeah, I mean, this would be what we usually see.
Okay. We have a question here that asks, how is it possible to know when you're ovulating? So I'm guessing it's short of using an ovulation kit. Is there any ways that you can, for example, spot that you're ovulating?
So I think the TCM practitioner would say that
Physician
you can...
Ho, speak again.
So without ovulation kit or without ultrasound, we do ask patients to track their basal body temperature. So
right.
yeah, so with basal body temperature, we can predict the next cycle when roughly when the ovulation will be. Then also, I think many of the couples know that you can download apps to track your menstrual cycle. So these apps are typically quite accurate in predicting your ovulation. And then symptoms-wise, you can actually you just observe whether you have any vaginal secretion. So it's like the egg white consistency, like when you do this, then you see it's thick. Yeah, slimy. Yeah.
I've heard about that.
Yeah.
So what does that mean? That means your ovulation cycle has begun or ended?
It's coming.
Oh, it's coming. So
yeah,
you're
ovulating soon.
No, that's good because the discharge tends to be slimier about a week before ovulation. So that's a prime time for you to start trying. Yes. So if you are able to observe this discharge changes, right, it will be useful.
How does it differ from normal vaginal discharge?
I think you're asking this. No, I think you're asking this question because you are a guy. A woman will be able to know what we are talking about.
To tell the difference.
Yes.
Okay, so
but of course,
I'm just gonna expect you to know lah. If you don't know, then maybe you're a guy asking me a troll question.
No, so some ladies can observe this. Obviously, there are some ladies.
To be honest, my wife and I couldn't tell.
Yeah. So some ladies can't. They're not sensitive to the changes, or there may not be any changes at all. So that's fine. So either ultrasound can do some follicular tracking, or usually a black-white. That means a black-white blood test confirmation would be the progesterone levels at the about 1 week after ovulation. That would be the peak of it. Yeah. Then it will confirm for sure whether you ovulated. So a lot of I believe if you go for fertility health check, your doctor would usually advise you when in the cycle to do the blood test.
Right.
But there's a retrospective thing. That means you can only tell you ovulated in that period of time after you
They missed the point
ovulated.
already.
Yes.
And that's why if you answer the feedback form at the end of this, you stand a chance to win a goodie bag with ovulation kit. It's also not very expensive if you like to buy it. What my wife does is that she likes to buy pregnancy test kit. Then when her period late for one day, she just wastes one test kit like that. And it breaks my heart that she just keeps trying and she really enjoys using it. It's been 1 year of thrown away pregnancy test kits. Okay, and that kind of brings us to the end of the Q&A session. If you have any more questions that were not answered, what I Love Children will do is they'll work together with the physicians and doctors to answer them, and then it will probably come out in an article. Am I right? It will come out as an article. Sorry. And with that, I would like to thank all of you for your time. Thank you very much for tuning in. I'd like to thank Jane, Dr. Balaji, Dr. Janice Tung, and Physician Ho for the sharing. You'll receive an online form shortly, yeah? So this is the one I'm talking about just now. Remember to submit the completed feedback form for a chance to receive the Point of Care International goodie bag consisting of 8 ovulation test strips. Now you know why it's cool. And 2 pregnancy test kits. That will never be enough for my wife. Terms and conditions apply. Do visit ilovechildren.sg to register for the next webinar. It's happening next Friday at 8 p.m. featuring doctors from KKH and SGH. Sign up to receive a fertility health check or traditional Chinese medicine fertility consultation. I stumbled at the same combination of 3 words. This event is organized by I Love Children and supported by Thomson Fertility Center, Thomson Chinese Medicine, Singapore General Hospital, KK Women's and Children's Hospital, and Asia PR Works in support of Made for Families. Once again, I'm John. It's been a pleasure hosting this event, and on behalf of I Love Children, goodbye and good night.